How long does it take for Selank to work? In this video, I'm going to deconstruct, first of all, what Selank is, why I love it, how it's utilized, from an administration perspective. And then I'm also going to show you why we use this at our famous peptide party. So if you've not attended a peptide party, go to agelessfuture.com and sign up for one of our longevity retreats. I'd love to have you there. But I'll also show you why Selank can help with creativity, focus, why it's a nootropic, what it does for the brain. And I'll even show you some of the utilizations of preventing viral replications in the sinuses with Selank. Let's jump into the video because by the end of this, my goal is for you to have 100% clarity on how you can use Selank over benzodiazepines and use it as a preventative tool to make your mind happy, creative, and to help you be a fully expressive human. All right, so I'm Regan Archibald. I'm the founder of Ageless Future. We have centers throughout the United States. We work with people internationally, and I love peptides because they are that leverage point that have allowed me to feel my best. They've allowed thousands of our clients to feel their best as well. Selank is 7 amino acids. It was discovered in Russia, and in Russia there's this term called nootropic that was coined by Dr. Guardier, and what he found is that the athletes who they were working with, they reached their physical prowess and they were just at the peak, and this was in the 80s. And you guys remember the Olympics where we had Russians in the United States. I don't know if you watched this as a kid. I remember I'd watch it and it was just always like, can we beat the Russians? And I love Russians, by the way, but that was just what was going on and it was kind of fun. But what Dr. Guardier realized is we've got to work on the brain. And so nootropics are agents that are neuroprotective. They help you perform better under stress. They also can't rob from one part of the brain to feed another, like some of these stimulants do, Vyvanse, Ritalin, Adderall. He also said that these peptides, they have to have long-term benefits. So it can't just be short-acting. Selank, if you think about how quickly it works, it's very fast acting. In fact, one of the studies they did is they wanted to determine if Selank had any antiviral or antimicrobial properties. And what they found is that Selank could immediately disarm any viral replication in the sinuses, bacterial replication, or fungi replication. So for those of you who have been exposed to mold, these mycotoxins, I've talked about this on the channel previously, but these mycotoxins can really impair your brain performance. They can create brain fog. It can just make you feel really sick, even though you don't really understand why. These molds are invisible. You can't see the spores. Sometimes you can smell them. So if you smell mildew, be on high alert. You want to go find out the cause and get rid of that. But what they found with Selank is instantly it helps stop viral replication. We used this during COVID in 2020, and I don't know for a fact, but we did seem to have fewer incidences of our patients being infected by COVID. And so I've used Selank for years, but not just for the viral replication. This is a kind of a nice nuance, but for the instant relief that I get from it. So what Selank does, and like I mentioned, it's 7 amino acid chains, and it mimics exactly the structure that's going on in your brain that turns on genes. And there's been over 52 genes that have been identified with Selank that turn on GABA production. And so GABA is that neurotransmitter that allows your body and brain to feel relaxed. It's that thing you chase after. If you've ever drank alcohol and you get that first little buzz, that's GABA release. But you can use Selank in place of it now. It's great and it's fun, it's healthy. But what this GABA does is it helps your brain to become more creative. It helps you feel more social, more communicative. Selank is also very protective when it comes to anxiety. Now, in one of the studies, I thought this was pretty fascinating. They took this, and the title of this is called Benzodiazepine Addiction and a Difficult Story. And they looked at the overall perspective on benzodiazepines. And if you're not familiar with benzodiazepines, this is like Xanax, Klonopin, Valium. And these are classes of drugs that people take when they have severe anxiety. Now, the dangers of taking benzodiazepines, as was reviewed in this study, they found that there were risks of benzodiazepines when it comes to long-term. They found that there's a tolerance that gets built up, so you have to take more and more more of the drug to get the benefits. There's dependence that happens, and then there's withdrawal. And there can even be neuropsychiatric sequelae, meaning you can have patients ended up having more disturbances from a psychiatric perspective when they took benzodiazepines long term. So these are something you don't want to mess around with. What they concluded at the end of the study is they said long-term benzodiazepine use carries significant risk of pharmacological tolerance, physiological and physical dependence, withdrawal syndrome, and cognitive impairment, especially in older users. This study was conducted in Russia, so take it for what it is, but actually now that we have translations, happened in 2008, they wanted to compare the effects of Selank to benzodiazepines. Now this one I thought was phenomenal because I can tell you of the thousands of clients that I've worked with, at least 50% of them have some degree of anxiety. We work with very high-performing entrepreneurs, people who are making massive changes in the world, people like you. And, so when you're pushing yourself and you have these big ambitions for the future, you can get some anxiety because anxiety is this fear of the future. Like, am I doing enough to get to where I want to go? And so what they did is they looked at the benzodiazepine, and this one was called midazepam. And then they treated two groups of people. There was 62 people in the group. 30 of them got Selank. 32 got the midazepam or the benzodiazepine. And both of these treatment groups had a reduction in anxiety. But Selank, they found, also increased what are called enkephalon levels. And this was low also in these patients. And they found that Selank was a little faster acting. Participants, on average, they felt much greater relief from the anxiety within the first 24 hours of taking it, whereas the benzodiazepines didn't necessarily come in that quickly. But they also found that it had a greater level of long-term stability for anxiety, or it had a better anxiolytic benefit without the dependency risk that they found with the benzodiazepine. And so this is phenomenal. So anyone who has GAD or general anxiety disorder, Selank may be a great treatment route for you. So once again, Selank is something that can be administered very safely. I'm in several longevity communities, and in one of the groups, there was a psychiatrist who was questioning one of the doctors for prescribing Selank to his client. And the psychiatrist was frustrated because he's like, this Selank is just placebo, it doesn't work, there's no studies on it, and it's not safe. And the doctor actually said, well, let me prove it to you. And he did up to 100 times more the dosing of Selank. He's literally doing a nasal spray like every 30 minutes for 3 days straight, no side effects. Now, I'm not saying try that, but what we do know with Selank is it's something that's very well tolerated. There's been no lethal dose ever established. It's mimicking exactly what's going on in your brain. It's a true nootropic. It does fit Dr. Guardier's model of what is a nootropic because it's not robbing one part of your brain to feed another. It's not like you're getting GABA and then you're hungover the next day. Similar to benzodiazepines, so many of my clients, they feel instant relief from it, but then it has diminishing returns and they don't feel the same benefit, and then they also feel really drowsy the next day and their brain just feels kind of foggy. So if you do have anxiety, talk to your doctor, and if your doctor's trained in peptides, maybe talk about Selank and say, is this a natural option that I can use? And Selank is best administered intranasally, so you just take a nasal spray. It has very little odor, no odor. It's just almost like spraying water in your nose. But the results have been nothing short of life-changing for many of my clients who have anxiety disorders. I like using this in the afternoon where your brain needs a break from all that focus throughout the day. Afternoon, evening, I want to be present with my wife, with my kids, with my dogs, with my exercise, and Selank's been beautiful for that. So hopefully you guys, if you like this and you want to go deeper, you can go to agelessfuture.com. All right, so in summary, Selank, how long does it take before you're going to notice a difference? Well, if you're worried about viral infections and bacterial, fungal infections in your sinuses, you want to use it before the infection starts, immediate benefits. But from an anxiolytic or from that anxiety relief, it's going to happen instantly. You'll notice that GABA within 30 minutes. For those of you who have long-term anxiety issues or sleep issues, it may take 3 or 4 days, but even in the study that I referenced, they found that people who used Selank actually had a faster response than they did with the benzodiazepine. So hope that's helpful.